Hello, I'm Sydney Kohara. Joining me is Dr. Richard Anderson, chairman of the Doctors Company. He's here to talk about a crisis in healthcare, specifically the explosion in medical malpractice litigation. Doctor, thanks so much for joining me. How big of a crisis are we talking about?
Oh, it's a very serious crisis now. The notion that malpractice litigation only targets America's bad doctors is simply not true anymore. If you're a neurosurgeon now, you're looking at a malpractice claim every other year. In other words, 50% of America's neurosurgeons get sued every year. The numbers are almost as high for other high-risk specialists, ER doctors, obstetricians, orthopedists, trauma surgeons. Even America's beloved family practitioners get sued. 10 or 15% of them will face a claim every year.
How bad is it?
Almost 1 out of every 10 or 11 claims in the United States now costs more than $1 million to close.
What is the impact on patients?
The situation is getting so bad now that many communities are losing access to vital medical services, from rural communities that have no obstetrician or no neurosurgeon to urban centers that have lost their community clinics or experienced the shuttering of their county hospitals, simply because they cannot afford any longer to pay the cost of malpractice insurance for providing services in that area. The other aspect that I think has to be of very much concern to all of us is the cost of defensive medicine. The federal government has estimated that we spend about $100 billion a year on defensive medicine.
When you say defensive medicine, explain that.
Well, defensive medicine means that tests or procedures that are done with no purpose other than to protect the physician against litigation. If they were warranted in the first place, then by definition they wouldn't be in the realm of defensive medicine. And as I say, federal government estimates that cost at $100 billion a year. Some Stanford researchers similarly estimated it at $50 billion a year, looking only at half the United States. So it's a very plausible estimate. Now, to put that number in context, $50 to $100 billion a year would be enough money to provide health care for virtually all of Americans who today have no health insurance whatsoever. And yet this is money that is absolutely wasted in today's medical practice.
What lessons has California's experience with MICRA taught us?
Well, MICRA teaches us several things. First of all, that there are several fundamental tort reforms that really do work and that they are sustainable over a quarter century's experience. We don't need to do any more studies. We have 25 years of experience. And we know that these reforms can be accomplished without limiting in any way the patient's ability to recover full indemnification for actual damages. And we know that these reforms can be accomplished in a way that in no way limits patients' access to court. In fact, one of the ironies is that California is quite a litigious state, and in fact, malpractice suits in California are 50% more common than in the rest of the country. Yet despite that, premiums in California are relatively low because MICRA keeps the damages at least a reasonable basis.
Why haven't other states done something? Why is it taking them so long to recognize there's a problem?
I think, it takes a long time to recognize that there's a problem. Physicians have borne up under this burden of litigation for a long time and have paid very large premiums, but have to some degree in many states accepted them. In the last few years, the size of malpractice losses has increased so rapidly that the premiums necessary to pay them have escalated to the point where they're actually literally unbearable. Physicians simply cannot afford to pay them.
Give me an example, say California versus Texas or Florida that don't have tort reform.
Well, in the last 25 years, the average premium in California has risen by less than 3%. In the last 3 to 5 years, the average premium in Texas, Florida, West Virginia have increased by 20 to 100% or more just in the last few years.
Dr. Anderson, what are the principles of tort reform?
There really are 4 fundamental tenets of MICRA. The first is a $250,000 cap on non-economic damages. But again, I emphasize that's only non-economic damages. It's the lottery aspect of litigation that's eliminated. There is no limit on indemnification of actual damages. Second is a collateral source rule, and that's simply a rule that says there's no double dipping. If you've already recovered your health care costs from your health insurance or your lost wages from workers' compensation, you shouldn't recover twice through a medical malpractice suit. The third is the periodic payments clause, and that simply says that if the intent of a malpractice judgment is to provide relief over, say, a 20-year period of time,
for the rest of your life,
then the judgment will be paid out over that time frame. And that does a couple of things. First of all, it assures that the money that you need will actually be there at the time that you need it. And second, it allows the insurance system to accommodate even very large judgments without facing the threat of bankruptcy or serious disruption because of a single large judgment. The final fundamental tenet is the very modest limit on attorneys' contingency fees in California. And of course, the point is that the injured patient keeps more of their judgment. A plaintiff in California who wins $1 million verdict keeps $779,000. A plaintiff in a state with a 40% contingency fee has to give $400,000 of that fee, of that judgment, to their attorney.
Who benefits most from tort reform?
The public benefits from tort reform. All of us are patients or potential patients. We all are going to need access to care. We are all going to be in a situation where either we or our loved ones are going to be looking at a doctor one day and asking that physician to undertake a very hazardous operation or try an experimental procedure or respond to us at 4 o'clock in the morning following an automobile accident in the emergency room. We don't want our physicians looking over their shoulder at those moments, wondering whether or not the rendering of that life-saving care is going to lead to a malpractice suit which devastates the rest of their career. We don't want a situation where malpractice litigation continues to add cost to the already very high price of America's health insurance. We don't want a situation where malpractice litigation adds $50 to $100 billion a year to America's health care bill by forcing America's doctors to practice defensive medicine.
So what do you say to those who just want to maintain the status quo?
The only people who benefit from maintaining the status quo are America's plaintiffs' attorneys. Certainly, patients don't benefit from the status quo because it's very clear that these malpractice suits increase the cost of health care and threaten even access to the most fundamental services like trauma centers, delivery suites, emergency rooms. So patients certainly don't benefit. But for plaintiffs' attorneys, this system is a bonanza. 70 to 80% of all the malpractice claims filed by America's plaintiffs' attorneys are found to be without merit. Yet the few that are found to be successful pay such large indemnities in today's environment that plaintiffs' attorneys can make an exorbitant living doing this.
Why, as consumers, should we care about this?
Well, you know, I've spent my career as a physician fighting the plague of cancer, and that is truly a life and death kind of battle. But the plague of litigation, while not perhaps literally life and death, I do think is a very serious challenge for our society, because I do believe that our system of litigation is a form of cancer that is eating at our delivery of health care. It is not making our health care system better. It is making our health care system worse. Anything that makes our health care system worse is something that I want to fight against.
Dr. Anderson, can we go back to those days when you first got out of medical school and it was a more simple world?
I don't know that we can ever put this horrible genie back in the bottle. I think it's going to be a long time before we have dealt with all of the ramifications of the litigation epidemic that's afflicting our whole society. But I do think that the United States as a whole could readily adopt the micro-reforms, and that we would be a better country, a better society, and certainly have a better system of medical care if we did so.
Dr. Anderson, thank you.
Thank you very much.